Hey guys, this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And today I wanted to talk very briefly about my stance on the taking of pain medications while also running or training. In one word, I guess I would say don't. So some people, I would say a lot of runners each year or at some point in their life will have at least a nagging pain of some sort, whether it be something minor or something major. And what we see is that some people will take like a Tylenol or ibuprofen, or in some cases after long periods of time. If those aren't working, they might take more strong pain medications in order to actually run. This is a huge red flag, okay? Because what can happen is that your body is telling you that there's something wrong. When you have pain, it's your body signaling, saying there's something wrong. In more chronic conditions, you can have that signal lasting longer than intended, even if the tissue itself is healed. But it's still not a good idea to take pain medications just to run, because you can cause more damage to the tissue than you realize. So say it's something really small. It's a minor quadriceps strain, for example, and it's causing you pain, but it's only painful when you're running, right? This happens to a lot of people. You might have someone that takes ibuprofen to be able to run with a quadriceps strain. And what happens is they go a little bit harder than maybe they should have, and they turn a small injury into a more chronic injury because they weren't able to listen to what their body was telling them, because they were taking pain medicine, which was blocking that signal from the nerves. So effectively, they took a small injury and turned it into something more serious, say a muscle tear. And this can happen with all sorts of injuries, turning really minor injuries into more potentially debilitating injuries that can keep you from running at all. So I don't want to go on and on about this, but it's just something that I've been asked several times from runners and from weightlifters. How long should I wait after taking ibuprofen or pain medication before I can run? And what I would say is, if you have taken it within the last 24 to 48 hours, that's probably too recent, okay? I'm not even going to get into the steroid injections, the hydrocortisone injections. We can talk about that in a later date. But just to really quickly state my opinion on that, honestly, it should be anywhere from 6 to 8 weeks, maybe more, after getting a steroid injection. Okay. Like I said, I'll go into this maybe even tomorrow, the steroid injections, but I could go on a long tangent about that, so I won't do that for this video. Just wanted to keep it brief and mention and just talk a little bit about the importance of not taking pain medications in order to run. And if you are requiring pain medications to run, maybe you need to think about taking the day off or doing another activity, cycling, swimming, go out and play basketball, do something other than going out to run, because that repeated stress can be damaging if you're not able to listen to your body's response to that activity. So once again, this is Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And if anyone has any questions on what I talked about today, please feel free to put those in the comments, or if you or someone that you know is dealing with a running injury, have them reach out to me, or they can even join our free online support group called Running Injury Support Group. You can find that just by searching that on Facebook. So hopefully you found this helpful, and I'll see you next time.